Hi, welcome to Girl Talk, a service of Forest General Hospital presented by Spirit of Women. I'm Dr. Hattie Forrester, and today we're talking about puberty and what to expect as your body goes through these changes. Puberty, of course, is the phase of growth where the body transitions from a youthful look to a more adult appearance. This happens at different times for girls and boys. Girls will typically enter this phase between 8 and 13 years old. Puberty begins when hormones from the pituitary gland start to stimulate the ovaries, uterus, and breasts. This process usually lasts 2 to 5 years. This release of hormones, especially estrogen, may result in mood swings, depression, irritability, and sensitivity. These hormonal changes can also affect oil glands that may cause acne. One of the most noticeable changes for girls is a change in height, sometimes referred to as a growth spurt. Girls may outgrow boys for a short while. However, boys typically end up taller than girls. Breast development will begin during this time and continues through the end of puberty. The hips will widen and weight will redistribute, sometimes narrowing the waist. Hair growth on the pubic area and legs will increase. Just after the breasts begin to form, hair in the pubic area will also begin to grow. It will be soft and thin at first, but become coarser over time. Within 1 to 2 years after puberty begins, girls will have their first menstrual cycle or period. Starting your period can be a confusing time. It's normal to question the many changes happening inside your body, or to feel self-conscious about changes with body odor, skin changes, hair growth, and differing rates of development between you and your peers. In preparation for your first period, you should buy supplies to carry in your bag or purse. This kit should include a panty liner or pad and clean underwear in a discreet bag. In an emergency, toilet tissue can work until you can get a panty liner or pad. You can also ask a friend, school nurse, or teacher for help. Most schools keep extra supplies for exactly this reason. The medical term for your period is menstruation. It is the shedding of the lining of the uterus. It occurs about every 28 days and lasts 5 to 7 days. Your first period has arrived. I'm sure you have lots of questions. Your period may have a wet or damp sensation, and some girls experience cramps or have sore breasts during their period. There is no way to tell when someone is on their period. However, you may find that you crave certain foods, see changes with your skin, or notice changes in your mood around this time. It's important to take care of yourself during your period. You can do that by eating a diet filled with fresh fruits, vegetables, and whole grains for energy, and foods rich in iron to support your system. Getting more sleep. The average teenager needs 9 to 10 hours of sleep, but typically only gets 6. Remember, you can't make up the hours of sleep you lose. And exercising. Regular exercise will help reduce menstrual cramps and stabilize emotions. Energy levels may fluctuate during menstruation. It can be lower for some and higher for others, but it doesn't limit your ability to participate in any activity. The first day of your period is the first day of your cycle. The last day before you begin your period is the last day of your cycle. The typical cycle is 28 days. However, a cycle can be anywhere between 21 to 35 days. You can use a handwritten calendar to track your period. There are also many apps available online to track your period. By watching this video, you are already taking the first steps to prepare and understand your first menstrual cycle. We encourage you to also talk to a trusted adult. Your mom, grandmother, aunt, doctor, or school nurse can help answer questions you may have about starting your period. If you still have questions, there are also many books or reliable online resources available that may provide answers. As always, you are encouraged to talk to your primary care physician. They are the best source of information when it comes to your personal healthcare needs. For more information or to find a physician, visit foresthealth.org/girltalk.